Hi, I'm Dr. Trent Corey. I'm here at Elevate Wellness Northwest and Woodland. Super excited to be here. I'm here to just kind of show you the machine and what it's all about. It's called Softwave. Works really well to stimulate the body's stem cell healing response. It provides a very strong stimulus to the body. So we're going to do this on Chelsea here. She's also had it before on the knee, correct?
Yes.
And then you have some issues in your neck and shoulder we've talked about.
Yeah.
And what we're going to do is just kind of just demo and just show you what it's all about. So just going through a basic treatment. You let me know, but when we're trying to do a stimulated response where the body's like, it's pretty uncomfortable when we get it, but that's the whole point, is to get the body to go, oh, this is like an injury, but it's not actually injuring the tissue. It's actually creating a body's response to produce their own stem cells and own cellular growth factors, all the goodies to get the body going. So we're looking along the path of a nerve that we had going on. It was kind of like pain with like extending back. So we'll just take a look and we'll just see where you have an issue. And then if it's uncomfortable, let me know.
Okay.
Where you're in charge. And I always let everybody know that it's nothing to be too afraid of. We're just going to make sure that we're guiding you through it. So you let me know as we go, okay?
Sounds good.
And so we use ultrasound gel, and unfortunately it's not too warm.
It's okay.
So we're just going to go here. Excuse me here. So we're just going to go right on here. It was kind of in the front of that shoulder, and like you said, it was kind of more neck into shoulder.
Yeah.
This works for all different body parts. You said, Chelsea, before that was in your knee.
Correct.
We do ankles, we do feet, we do neck, shoulder, back, everything. We just make sure it's on the skin. We make sure it's making sure we have enough ultrasound gel. And what we do is, if you kind of look up closely here, it creates this shock, so you can kind of see it there. But you can even put your hand on it, and it doesn't cause any bit of discomfort. It's just a strong pulse, okay? There's a shock inside the water, creates a wave of the water to go through our body, which is mostly water. And what that's doing is creating a very fast wave that creates a shearing force at the cellular level. So it doesn't hurt over normal tissue, but over tissue that might have some scarring, adhesion, inflammation, etc. It'll be a little bit of a stronger thing that will give us good feedback on where we need to direct the treatment. Okay, so we'll get started, we'll get going here. So we'll come over here and let's see, we're on level 11. I'm gonna try this level, we're gonna start about 8 or 9, but if you find it's too uncomfortable, I try to go to the spot that's uncomfortable, or normally not too uncomfortable, but you let me know.
Okay.
Is that okay there?
Yep.
And then we're just gonna move it around to just different spots and just kind of see where we might find some things. You let me know if it's too much. You okay there?
Yep.
Okay. Kind of in that range of something.
Something's
Something's
yep.
there.
Feels like deeper in there.
Yeah, right. And so we're looking for some things where we want to see if it goes deeper to the tissue, or referral patterns. Like it might go somewhere other than where we're stimulating. But what we try to do is just go slowly over a spot and just kind of figure out where it might be. Based on what we've talked about earlier, there was some suspicion of like tenderness in the neck area and like kind of where that's going down underneath the collarbone.
Well, I felt it down to my shoulder blade even.
Yes, yeah, totally. So it's a referral pattern from upper trapezius goes down into the back of the shoulder blade. So we just try to work on those things and find those spots. And then we always be mindful like going straight over bone, because bone is pretty uncomfortable because it's just harder tissue, but we want to make sure we're getting on there. We're going to come back here a little bit. How's that one?
Okay.
Okay. As you can kind of see back here, but we're just kind of getting on the back part of the shoulder. A lot of people have some nasty parts, like irritation there, trigger points in there. So just kind of working through those spots, because that's kind of where things kind of go. And then we're going to come around here. I'm going to go, so your collarbone is right here, and then we're going to go right underneath the collarbone here on like your pec into here. Okay, so here we go. And into the front of the shoulder. Okay there?
Okay, yeah.
Not too bad.
Much different sensation than the knee.
Yeah, okay.
Yeah.
Is that going down your arm at all, or just kind of staying right local?
Staying right
okay,
local.
yeah. So we try to find different spots where as we're doing this, we're visualizing where the joint is. We're trying to think about where in the shoulder it may be. We're going to go around where the rotator cuff muscles attach. So we're just looking at different spots that kind of give us a higher signal of like, okay, we should be addressing more attention to that spot. And so we'll kind of go around here. A lot of times I'll give you a pause break to kind of like, okay, and get myself mentally set, because it's pretty like, okay, it gets your energy up a little bit, and that's okay.
Yeah.
And we'll go here. We're gonna get you here on the side. and we'll adjust the energy level up or down if we find it needs to be stronger or weaker. So if we have to turn it down, we will. If we have to turn it up, we will. How are we doing?
Very,
okay, now we're in a zone. You can always tell by facial
language.
Your body language and facial expressions that it's like, okay, we're in a spot that we need to be kind of hanging out for a little while. And ideally, we want to stay in that zone where it's 5, 6, or 7 out of 10, so it's pretty high level. But if you start flinching or it's like, boy, it's way too much, if we get to 8, 9, then we need to get out, we need to turn it down and give you a break. But the idea is I want to kind of stay on that spot and then hang out there for a while. And ideally, we want to see a dissipation of that pain during that time. Sometimes I got to give it a break. I'll go somewhere else and then come back to it. So I might come around to the back here.
Yep,
Okay,
there
yeah,
it is.
okay. So I'm gonna change my mechanics here. I'm gonna actually go left-handed here.
Okay.
So I can get my left-handed Softwave skills down.
Okay.
So we're gonna go here.
Okay.
We're gonna go right here on the back of the shoulder. Yeah, right there. Okay. So these are all good things when we find, and it's kind of funny when people say, oh, that hurts, and then I say instinctively, oh, that's good. It kind of seems like, what's wrong with this guy? But the main thing is like, I know that I'm hitting something that needs to be addressed. And that's why we're here, right? So people go, okay, yep, I know this is something, and that's kind of where they're feeling pain, so we know we're on a spot that we need to be putting attention to, which is nice. It's like a way that I can go in there without expensive imaging to kind of find out where a spot is and then direct treatment to it right then and there. Don't have to, it lets me know where I need to be treating, so it's good. How are we doing?
Good. I feel like you're coming to the edge of it, like almost like it could go a little forward.
Okay, so I come back a little bit here.
Or like, yeah.
Yep. And always feedback, in our case, because I'm explaining kind of as we go, but the key is really, during a treatment, want to tune in to what you're saying, hey, a little higher, a little lower. That's it, right?
Yeah.
You kind of know when it's that spot. So
feels like it would be right in the middle, like we almost.
So we're gonna move here. Yep. We're gonna go right here.
Yep.
Okay. We got it. And you let me know that's too much.
Okay.
And then I move around so much so that it's slippery. So right there.
Yep.
Okay. Okay. So we hang out here for a while.
When I wake up in the morning, it's hard to raise my arm.
Yeah.
And then I have to get it going, and that's the spot that it hurts.
Yep.
But I didn't pull anything or do anything. It just started hurting one day.
Absolutely. Yeah. Things get tangled up, or the little scar adhesions, things get stuck and inflamed, and then we find it on here for sure. Yeah. And I also know I can hear different sounds. Sometimes it sounds different, just the way it kind of makes that impact there. So you're like, yeah, I know. Okay, we're about done. So that's probably enough treatment for now. And then what we do is usually for a joint, we kind of go through a cycle of several hundred shocks, usually about 500 or even 1,000 shocks or so, depending on the whole area is what we look at. But we kind of start up here in the upper trap, went down to the front and around to the back. And there might be some other trigger points and things back here. I'm sure there are. We want to address the whole process and kind of figure out where those are, but then get a sense of how that's moving. And then after we're done with that, we can kind of reassess how things are going. Most people will do really well after the first time, but a lot of times you'll need a series of these. So the idea is like after three or four usually is a really good turning point where people feel like, wow, it's really turned around, because it takes a while for the bodies to stimulate the stem cells to actually go to the area to help that heal. So we need to give it some time. Once you give it some time, then the body can come back and heal, and then you start moving a little more spontaneously. And with PT, we have people do exercises and movements that kind of help the process along. Don't want to irritate it, but we're trying to plant the seeds of the stem cells, and we got to let it do what it needs to do right now. And then as it gets better, as the seedlings grow, then we can be giving it more vigorous movements and that kind of thing to kind of help support tissue growth and improve it. So, but yeah, thank you for being a volunteer. Working on that. It's really good. And then a lot of times I'll use, I don't have it on me, but a lot of times I'll use the gua sha tool. So well, a lot of times it's you got over the skin anyway. I'll kind of work on that tissue. I might do that off camera here, but like if you want to do that afterwards, that'd be good. Because the idea is just getting this tissue flow moving better. Things are restricted in some way. We found some spots. Let's just get some gunk out of there. Let's get the healing to maximize the goodies in and the yuckies out, and then let's get things moving. So, but that's what it is. Softwave is what it's called. Really amazing technology. I was talking to Keisha earlier about how, once I knew that this technology existed, I couldn't unknow that this thing existed. So I felt like I was compelled that I had to come get it from my clinic in Vancouver. Yeah. So once I couldn't go without it, so I went and made a big decision to get it, and I'm really glad I have. I had it for about a year and it's been great. So seeing the changes on people a lot quicker. Obviously they still need to do their therapy exercises and movements and things that get them better for long term, but this has been a really nice game changer for my clients to just feel better sooner, get back to what they need to do, and then when their recovery and the rehab goes, they're much stronger, they're better. So that's what it's all about.
So cool.
Yeah, very cool. Yeah. So thank you so much.
Thank you.
I'm glad to have it, glad to be here for sure. Yeah, thank you so much. Yeah.